But the most dramatic part of the job is that an implant here is completely piercing the canal where the patient's nerves pass. And the patient has not felt his lower lip in any way for 2 years.
Hello, I'm Dr. Onur Utku Yüksel from Soho Dental Clinic. I am a specialist in implantology and periodontics. Many patients come to us unhappy after having had implants done elsewhere. Sometimes they need revision implant surgeries due to uncorrectable aesthetic problems caused by incorrectly placed implants, and sometimes with complaints of pain and infection. In these revision cases, which are much more challenging than operations done from scratch, our greatest happiness is to restore the smiles and self-confidence of these patients who are in a dramatic situation. Now, I want to tell you the stories of revision surgeries for some similar cases.
Here we are again with the story of a revision of a failed implant treatment. He is the husband of a lady I mentioned to you before. They came to our clinic on the same leg. After his wife's treatment, he asked us, "Could you take an x-ray of me too? Could you examine me too?" He requested from us. We took intraoral photos. This is the initial state. 1 implant remained here. 5 of his implants had fallen out. In the upper jaw, he had a prosthesis like this on 5 or 6 implants. And unfortunately, this was the patient's initial condition. Just like his wife, there is bone loss around the implants in his upper jaw. Very short implants were chosen. The implant and prosthesis connections are poor. But the most dramatic part is that an implant here is completely piercing the canal where the patient's nerves pass. And the patient has not felt his lower lip in any way for 2 years. He doesn't get burned when drinking tea. Food spills from here when he eats. And the patient has been living with this for 2 years. Then our patient wanted to have only his lower jaw treated first. So we started with the lower jaw. He will come back to us later for his upper jaw after he gets things sorted, okay? We immediately began the patient's surgery. Our first task was to remove the implant that was touching and pressing on the nerve, as well as the other one. Then we placed our new implants as close as possible to the nerve exit points on the right and left, but without touching them, to provide maximum support to the chewing area. The length, diameter, and angles of our implants are quite ideal, and we sent the patient home with his temporary teeth. When our patient came back to us 3 months later for his permanent teeth, the part that made us happiest was that our patient was no longer numb. The numbness in his lips was completely gone. He could smile and eat with complete comfort. And in the end, we're greeted by our patient's genuine smile. As we always say, we don't sell implants. We use our years of experience to perform your implant surgeries. When patients choose the clinic, their goal shouldn't be just to buy a good brand of implant at the cheapest price. It should be to find an experienced team they can trust to perform such a delicate surgery. Don't leave it to chance and gamble with your health at inexperienced clinics that only focus on cheap prices. If you think you need implant treatment, or if you have a complaint about your existing implants, don't hesitate to have an online consultation with us.